Now the second MCQ is a 58-year-old African American female who sustained an injury to her upper arm 6 months ago presents with persistent arm pain. She was initially treated with splint, as is the protocol, with conversion to a fracture bracing. So the normal conservative method is to um, do the splinting for 7 to 10 days and then convert that into functional brace for 6 weeks. The question then says she is neurovascularly intact. An injury radiograph and a current radiograph are shown. So this X-ray is after 6 months and B respectively. Okay, what nutritional or metabolic disturbances is the most likely associated with this patient diagnosis? We also know that the vitamin D deficiency is the commonest cause of these non-unions. Also calcium, but let's see what is the answer. The patient has sustained a humeral diaphyseal fracture that has gone on to be an atrophic non-union. Vitamin D deficiency is the most likely associated metabolic disturbances. The incidence of non-union with non-operative management of fractures is 2 to 10%. Risk factors include vitamin D, most common, then the open fractures, then the segmental fractures, smoking, and obesity. So the vitamin D is the most common, and obesity and smoking are the least. Optimal treatment is compression plating. So in this patient we will do the compression plating with bone grafting, which has been shown to be superior to the intramedullary nailing with bone grafting or compression plating. Ring said that the fractures in the proximal or to middle one-third of the shaft with a spiral or oblique pattern were more likely to go to a non-union. Like in this case, it is also a long oblique. So these fractures will go more likely into the non-union. The patients were evaluated by the clinical endocrinologist evaluation. So this is the research which is showing that 84% had this vitamin D deficiency according to that Brinker study. So explaining the figure, it shows the figure A demonstrates a humeral shaft fracture. Figure B demonstrates an atrophic non-union of the humeral shaft fractures.